Your health insurance may be working just fine, but when's the last time you actually reviewed it? A health plan isn't something you should choose once and then forget about. Things like your health, medication, doctors, finances, and even the plan itself can change. That's why I recommend reviewing your health coverage at least once a year. And I want to make something very clear. Reviewing your plan does not mean you need to change your plan. Sometimes, after a review, the best decision is to keep exactly what you have. The goal is simply to make sure your coverage still works for you. When I review a health plan with someone, there are a few things we want to look at. First, your doctors and healthcare providers. Are the doctors you want to see still in network? Next, your prescriptions. Have you started or stopped any medications? Have your costs changed? Are medications still covered the way you expect? Then we look at how you actually used your coverage. Did you have more doctor visits than expected? Did you need specialists, testing, urgent care, or hospital services? We also want to look at your costs, not just the monthly premium, but your copays, deductibles, co-insurance, and potential out-of-pocket expenses. And finally, ask yourself, what has changed since I chose this plan? Maybe you retired, your income changed, you moved, you were diagnosed with something new, you started seeing a specialist, or maybe nothing major changed at all. All of those things can help determine whether your current coverage still makes sense. Because the plan that was right for you last year isn't automatically the right plan for you this year. But don't assume that means you need something different. Education first, decision second. Take the time to understand what you have, what may have changed, what your options are. Then you can make an informed decision about whether to stay exactly where you are or consider something different. If you haven't reviewed your health coverage recently, I'd be happy to take a look.